Today I'm going to do demonstration on the National Institute of Health Stroke Scale, which is called NIHSS. This is a systemic assessment tool that provides a quantitative measure of stroke-related neurologic deficit. The NIHSS can be used as a clinical stroke assessment tool to evaluate and document neurological status in acute stroke patients. The scale is designed to be simple, valid, and reliable tool that can be administered at the bedside consistently by physician, nurses, or therapist. So this is a simple, basic guide for myself. We have to do assessment on the 11 sections. First one is level of consciousness. For level of consciousness, if the person is alert, we just give the zero, and if they are not alert but arousable by simple stimulation, we give 1, and then if they are not alert and they need a repeated stimulation, we give 2, and if they are unresponsive, we give the score 3. So here my boy is helping me as a patient here. So simply I'm going to ask his name. Hi, what's your name?
Rashid.
Here I'm going to give the score of 0 for him. Another is on the same, on B section, it's label of question. Here we have to ask the patient what month it is and how old are you. If they are able to answer both questions correctly, we give the score 0. If they answer one question correctly, we give score 1. And then if they answer none of the question correctly, we give the score 2. So what month is it?
October.
How old are you?
I am 11 years old.
Here for level of conscious question, I'm going to give the 0 score. Another is a level of conscious command. Here we have to ask the patient simply if you can close the eyes, open the eyes, if you can close the fist and then release the fist. If they perform both tasks correctly, we give the score 0, and then if they perform one task correctly, we give 1, and then if they perform none of the tasks correctly, we give the score 2. So can you open your eyes for me? Can you close it? Can you make a fist with your palm? Another 1, 2. And can you release it? Can you do with the left hand? And then can you release it? Okay. Here I'm going to give 0 for this too. Another is a best gaze. On this section, we will see the horizontal movement of the eye. So we give 0 for the normal, 1 for the partial gaze, and then 2 for the forced deviation. Here, can you follow my hands? Here, okay. Can you follow? Here, okay. Here, I'm giving a 0 for the best gaze. Another is a visual field. It has a 3 score. 0 for no visual loss, 1 for partial, 2 for complete, and then 3 for if he has a visual loss on the both eyes. So can you close your right hand first, and then can you tell me how many finger I have here?
1, 2, 3, 4.
Okay, can you close your left eye now?
1, 2, 3, 3, 4.
Okay. So same way, I'm giving 0 here. Another we are doing is a facial palsy. Here we have to ask the patient if they can raise their eyebrow, and then if they can smile, If they do everything symmetrical, we'll give for 0, and then if they have a minor paralysis, we give the 1, and then sometimes they have partial, we give 2, and then sometimes they are like complete paralysis. At that point we have to give the 3. So can you raise your eyebrow for me? Can you raise your eyebrow? Okay. Can you smile for me? Okay. So here 0 for facial palsy too. Another one is a motor arm. In this section we are checking if there is any drift or not. So if there is no drift, we are giving 0. If there is drift, we are giving 1. And then if there is some effort versus gravity, we are giving 2. If there is no effort versus gravity, we are giving 4. If there is no movement, we are giving if there is no effort versus gravity, we are giving 3. If there is no movement, we are giving 4. And then if the limbs are amputated, then basically it's untested. So here I'm doing the what we do is can you hold this hand for 10 seconds? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. Here, can you do the same for the left hand? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. So here is no drift on the motor arm, so it's 0 for the both left and right arm. We can do the same thing for the leg too. So here, can you lift your right leg? Can you? This way. Okay. And then you have to hold it for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. Can you do the same thing for 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. So here is also I'm giving 0 for motor leg. Another is limb ataxia. So here, can you see my hair? Can you touch your nose and my finger, top of my finger, with your left hand? Good. One more. Okay. Can you do the same thing with the left hand? Okay. Another thing you do is can you do with your right heel on the top of the left knee, and then if you can put all the way to the left heels. Okay. Okay, can you do the same thing with the left leg? Okay. So that's for limb ataxia. So if there is no ataxia, we give the 0 point. If there is ataxia present on one limb, we give the 1. And then if there is, if it is present on the both limbs, we give 2. And then if the extremities are like amputated, then it is untested. So I'm giving a 0 here. Another one is sensory. Sensory, basically we use the let me grab the pencil. For sensory, I'm just using the pencil here, and then we can. Did you feel the same way on the both of your face or different?
The same.
Okay. How about on your leg? Do you feel any difference?
Same.
Okay. For the sharp object, I'm just simply using the pencil too. Did you feel any difference on the prick on your face? Okay. That's for the sensory. Sometimes when we do this assessment, they might tell dull on some side and then the sharp on some side. At that point, we can say we can base this score on the assessment, mild to moderate or severe. Here I'm giving 0 for the sensory. Another is the best language. So here I'm going to ask him to describe the picture, and then we'll test for the if he has any aphasia or not. Here, if you can you describe the picture here?
I see 3 people in a kitchen. The curtains are open. A boy is tipping over while he is reaching for cookies in a cookie jar. The girl, which I'm assuming is the daughter or the sister, is reaching for the cookies and pointing at her brother. And the mom is washing the dishes while the sink is overflowing. Yeah, I think I said that.
Can you read that?
I see cactuses, gloves, a chair, a key, a hammock, and a feather.
Okay. So he has no aphasia, so I'm giving 0 for him. Sometimes they may have trouble in explaining the picture. So based on the assessment, we'll give them mild to moderate, severe aphasia, or sometimes they even cannot speak. At that point, we give the 3 score. So another test we are going to do is dysarthria. So for dysarthria, we just give them to read the word here.
Mama, tip top, 50-50, thanks, Huckleberry, baseball player.
So here I'm giving 0 for him. It's a normal articulation. Sometimes they have mild to moderate dysarthria. At that point we give 1, and then sometimes they are not able to pronounce correctly, or they are not able to speak. We give the severe dysarthria, and then sometimes if the patient is intubated, then or other physical barrier, at that point we do not test for the patient. It's untested. Another is the extinction and inattention. Most of the time when we come to this section, basically we know everything about the assessment, if they have extinction or not. But sometimes we can do. Can you close your eyes for me? Can you tell me where I'm touching?
Right leg,
Close your eyes. Can you tell where I'm touching?
left leg, right arm, left arm.
Here again I'm giving 0 for him. Sometimes if they have inattention, most of the time during the conversation, and then with all those assessment we are able to know the findings for the 11 if they have any inattention. Here I'm giving 0 for him. And so for my score for him, I was doing on the normal person, so the score is 0 for him. 1 for 1 to 4 score, it is minor stroke. For 5 to 15, it's moderate stroke. For 16 to 20, it's moderate to severe stroke. And for 21 to 42, it's severe stroke. A baseline of NIHSS score greater than 16 indicates a strong probability of patient death, while a baseline NIHSS score less than 6 indicates a strong probability of a good recovery. Physician may decide patient placement whether they needed rehab or they can go home based on NIHSS score. This is not only the diagnostic tool for the stroke. The physician use this with the CT and MRI of the brain. Sometimes they use the NIHSS score before administering TPA for the patient. Thank you.